Hi everyone. Today we're going to be talking about the history of massage. So this is a really long topic that I'm going to try to fit into a somewhat short lecture. Maybe I'll break it down into different segments in other videos later for you, but let's try to hit the highlights that should be on your licensing exam and that are important to know. So, talking about touch massage, this is an instinctual drive for human beings. We naturally rub sore spots. Think about it when you walk through a door and you hit your arm on the door jamb and it hurts, you instinctually reach out to rub that sore spot. So, this is a natural and fundamental part of human experience that's not actually learned usually or consciously even chosen. This instinctive nature is even evident in early infancy, where tactile sensations play a huge role in development and bonding. And speaking about bonding, a little tangent side quest you might go on of learning adventure about oxytocin, that neurochemical that is so important in bonding and massage. I want you to research how Homo sapiens may have overtaken Neanderthals by utilizing the chemical oxytocin. Oxytocin may have been depleted or less than in Neanderthals, which also ties Neanderthal DNA, it is thought in some circles, to neurodivergence and lower oxytocin levels, especially in those on the autism spectrum. Super cool, but let's move onward and forward to the history of massage. I'm not going to reference your book very often during this lecture. When I do, it's going to be the Mosby's Fundamentals of Therapeutic Massage, and we'll be using the 8th edition. All right, so these two images are pretty provocative. So they're both from France and Spain, cave art from 17,000 and 15,000 BCE, clearly depicting a ton of hands. But what's important about this? Some of the other cave art that is depicted may be showing us touch-based healing rituals, laying on of hands by shamans for pain relief. Now, imagine you're 115,000 BCE and your back aches from carrying a mammoth carcass. There's no Advil, no foam rollers, just your shaman's hands, hot stones, and a prayer. Is this how massage began? There's actually older evidence than this. What's super cool is before there were any fancy oils that were being pressed from plants, early humanoids used mud, animal fat, and river stones to knead sore muscles. The first deep tissue session might have been pretty brutal, but maybe we're going full circle because I cannot watch TikTok for more than 5 minutes without someone advertising beef tallow for my skin. So from about 300,000 to 200,000 BCE, we have a lot of evidence of potential ritualistic civilization living in Siberia at the time. Now, this would not be Homo sapiens. Homo sapiens were in Africa at this time, but had not made their way over. So we're talking about Neanderthals and other proto-humans at this point. But it is suspected that around 260,000 BCE, the shamans were doing rhythmic drumming rituals to release cold illnesses like arthritis and using things like reindeer fat to do rubs for massages, as well as bone setting, because we have found healed fractures in things like femurs that have been dug up. So we're assuming that these are similar to chiropractic adjustments using pulling and pressure, and then some type of splinting to rest the bone. This is one of the first amazing signs of civilizations where others would care for someone else while they are healing. And again, this is a reason we believe that oxytocin is such a wonderful bonding chemical, not only in individual relationships, but also helping in building a productive society. Now we're going to head over from the cold in Siberia to the wonderful warmth of Australia, where we have Aboriginal bush massage. This is really awesome. One of the oldest continuous living cultures in the world. Their culture has been maintained for at least 65,000 years, with evidence suggesting they have been on the continent with this continuous culture since 63,000 BCE. So there's a lot of evidence for heat and herbal packs that have been used for this entire time. Warm stones and bundled leaves, especially with eucalyptus oil, eucalyptus leaves being packed in there to be pressed on sore muscles. It's also important to note that their healing sessions incorporated their dreamtime stories and rhythmic pressure along energy pathways in the body. So we weren't treating just the sore muscles, we were treating the energy of the body as well. All right, now we're going to swing over to Turtle Island, over to North America. And we're going to talk about early indigenous massage and bodywork practices, again, that are deeply tied to healing traditions, spirituality, and community wellness, long before formalized systems were ever developed. Um, Again, very focusing on energy and spirituality because touch was rarely just physical. It addressed the mind, the body, and the spirit. So there's a lot of use of herbs, hot stones, again, animal fats were openly available, and improvised techniques, elbows and feet, which we still use today. The skills were often passed down through apprenticeship, right? We're not using text at this point, and there is some contention between Western archaeology and oral tradition of indigenous tribes. Oral tradition says that natives have been here since time immemorial, and we have Western archaeological digs going back as far as 28,000 BCE in North America, which we can still argue is at least 31,000 years, 30,000 years. So definitely for quite some time. One thing I do want to point out here are the sweat lodge rituals. So, post sweat muscle kneading and joint manipulation were common for detox and relaxation. Midwives were known to do abdominal massage to ease labor, which is still practiced in some tribes today. As a side note, I would tell you to study some African abdominal massage techniques as well as Mayan massage, which we'll cover later. And again, we have laying of hands with healers using therapeutic touch to relieve pain, often combined with herbs and chanting. I do have two images up of a traditional sweat lodge built into a mound, as well as a modern day sweat lodge. And the premise is pretty much exactly the same. We've got heated stones, elements, and we have humidity with the steam rising from the water in there. So not much has changed other than the community aspect of it and passing on skills through oral apprenticeship. All right, so now a little bit more recent, we're going 5,000 years back to Mesopotamia. We have some cuneiform texts, super cool. Some of the earliest recorded healing practices involving touch and rubbing are on clay tablets from Mesopotamia, which is modern day Iraq. We have massage mentioned in the Gilgamesh epic that talks about therapeutic rubbing for fatigue and battle injuries. As well as in about 2000 BCE, we have Mesopotamian and East Indian art, carvings showing oil applications that are being put on patrons to relieve their pain. And we also have a Babylonian perfume maker. This is the first ever recording of a chemist using floral extracts. So thank our modern day essential oil use and perfumes that this was started and recorded in 1200 BCE that we know of. Now, going over to India, something that is perhaps a little bit more well known, talking about Ayurvedic massage and oil massages. These have roots reaching back over 5,000 years in Vedic traditions. We also have mentions going back at least 3,000, almost 4,000 years of using things like sandalwood, turmeric, and lotus in body healing rituals, as well as sesame oil, ginger, and turmeric for wounds. Turmeric is excellent combined with black pepper for inflammation. But oil massage was used as well as stimulating the marma points, which is very similar to acupressure that is used. Now we're going over the water to Egypt. Very cool. There's some text evidence that suggests that pharaohs actually got massaged with gold infused oils. And going back 5,000 years in the Egyptian tombs, we have paintings depicting men having their feet and hands massaged, which is the earliest proof of massage in art. We also have, about 3,000 years old, one of the oldest medical texts describing rubbing with oils to treat pain and stiffness that includes frankincense, myrrh, and juniper for healing purposes. All right, we also have China going back 5,000 years, utilizing techniques that focus on meridian pathways as well as acupressure, along with incense and acupuncture, burning herbs like mugwort for moxibustion during healing work. We also have several instances of traditional Chinese medicine utilizing traditional herbs and things like camphor and ginger and magnolia for healing. I'm not going to talk a ton about Chinese techniques. You should be studying this in your Asian techniques courses or your Eastern studies. However, please know they go back a minimum of 5,000 years, and the Yellow Emperor's Classic of Internal Medicine is really important. It does mention massage in 200 BCE, but again, oral traditions go back 5,000 years. Now we're heading over to the island of Japan, where Anma, the traditional Japanese massage, was introduced from China in the 6th century. And we also have shiatsu. Now, shiatsu means finger pressure, and this is important to note because I have heard this question on several licensing exams. This was actually developed in the early 20th century, which combines traditional Japanese massage with Western anatomy. Later, they also integrated traditional Chinese medicine meridian therapy to make Zen Shiatsu, which is basically using rhythmic pressure along energy channels to restore balance to the body. Now, that being said, it is important to note, I have also seen on the test asking what technique acupressure is similar to. And the answer would be Western trigger point therapy because you are using that point of pressure to relieve pain in some way or another, whether it's on an energy channel or on a hyper irritable muscle spot. Either way, the technique is very similar, and very often the test will refer the two as being similar to each other. So now we're heading to Thailand. Thai massage is very interesting. It actually goes back about 2,500 years and takes its roots from India and by Ayurvedic medicine as well as Buddhist medicine. So there was a physician to the Buddha that is attributed to founding Thai massage. And it did spread to Thailand through Buddhist monks and evolved with yoga like stretches and as well as energy line theory. Again, we're working with the body energy, but Thai massage is very vigorous, very full of stretching. It combines acupressure, assisted yoga postures, and deep stretching. This is a technique you really need to be familiar with working with your clients' joints, capabilities, active and resistive, as well as passive stretches. It is a very active form of massage to thoroughly stretch and work out the body as well as the energy channels of the body. All right, now we are heading over to Mesoamerica with Mayan and Aztec massage. These civilizations going back to 2000 BCE had sophisticated healing traditions that included therapeutic massage, herbal remedies, as well as energy work. Unfortunately, a lot of this was lost after the Spanish conquest. Historical accounts and surviving indigenous practices still reveal their unique approaches in the area to the massage. And I would argue some of the best abdominal work would be through Mayan abdominal massage. But the Maya viewed the body as connected to cosmic energy, and they used massage for both physical and again spiritual healing. We utilized herbal steam as well as the massage. So we had sweat lodges. Healers used hot herbs, such as like rosemary and steam therapy, followed by deep muscle work. So they were warming the muscles, getting that therapeutic oil to start working, and then they would do the deep tissue work. This was used for pain relief, purification, as well as postpartum recovery. They also had bone healers, like we discussed earlier, with the Siberian shamans, which helped to realign joints and muscles using pulling and pressing and twisting, similar to chiropractic adjustments. And then there was a digestive and fertility massage, often with warm oils or clay. They also used massage to regulate menstrual cycles and improve digestion. And healers would also check pulse points to diagnose energy imbalances, like in traditional Chinese medicine. So we see a lot of this energy work and complete body healing being done again and again in these indigenous cultures all across the world. So the Aztecs are a little bit younger than the Mayans. They're from the 1300 to 1500 CE, combined massage, herbalism, spiritual cleansing in their healing practices. Again, they had ritual sweat and massage to heal wounds, treat cold illnesses like arthritis. One thing to note, much like Chinese massage, they used obsidian stones, sort of like gua sha stones, to scrape the body to help detoxify, also to work on scar tissue. They had healing touch for trauma to release bad energy from injuries. They used acupressure like points along energy lines as well, similar to that Zen shiatsu. And they also mix cacao butter with chili or vanilla for anti-inflammatory purposes. And they use smooth volcanic stones for scar tissue release, scraping those fibrotic tissues to loosen that scar for better flexibility and movement. Again, they also had postpartum and fertility massage like the Mayans, and Aztec midwives often used warm compresses and belly massage to aid recovery after childbirth. So I've included the timeline that is in your Mosby's book here if you would like to pause and look at it. We're going to talk about the important features on here in more detail as we continue to go through this lecture. It's just really important to note that Western massage had sort of shifted from an ancient medical practice to a forgotten art. Then it gets picked back up again in the 1500s for medical rehabilitation and slowly evolves into our modern wellness industry. Eastern massage has continued to focus for 5,000 years on energy flow, treating the whole body. They were creating medical texts while we suffered a nearly 1,000-year period of the Dark Ages where massage was considered a sin, and the East kept continuing to develop their techniques. Eastern massage focuses again energy flow, whole body. Western massage or allopathic medicine is more anatomy based and blends science with hands-on therapy. So we're going to dive into some of these Western contributors to massage as we go on. This is the second portion of the timeline from Mosby's. If you would like to pause and look at it, again, I'm going to talk about the most important contributors that I have seen on the licensing exam on the next slides. Of course, I cannot start talking about the West unless I talk about Hippocrates, or Hippocrates, tomato, tomato. Hippocrates is known as the father of Western medicine, born in 460, death in 370 or 377, depending on where you get your information. He was a Greek physician, and he is known for making massage important in medical treatments. All right. He is known for an ethical code for physicians. The Hippocratic Oath was developed by him. The doctor do no harm. But he listed rubbing or massage or anatripsis, which means rubbing up or friction massage. He said the physician must be experienced in many things, but assuredly in rubbing. He elevated massage from a folk remedy to a required skill for all professional Western healers. He recommended it for musculoskeletal issues, circulatory problems, as well as general health. So now we're going to Rome and we're going to talk about Claudius Galen. He was born in the year 129, thought to have died in the year 216. He was probably one of the most influential medical authorities for the next 1300 years after his death, because about the 400s were entering into the Dark Ages and not much was being done during that time to advance medical discoveries, especially in the realm of massage. Now, your licensing exam contributes the discovery of arteries and veins to Claudius Galen. And while that's not technically true, it was already known to earlier anatomists, he did further the information about them. It had been previously thought that arteries carried air around the body. Claudius Galen definitively proved that they carried blood. He also showed that there was differences between arteries and veins, that they were two different sides of the coin of the same circulatory system. What's important to us as well as massage therapists, besides your test claiming that he is responsible for the discovery of arteries and veins, is that he did expand on Hippocrates' categories and defined three types of anatripsis, which again is friction rubbing or massage. He broke them down into firm, gentle, and moderate, and described what type of health conditions those are important for. He also always integrated massage directly into his physiological theories. He believed that massage would balance the body's humors and tones by removing excess fluid and strengthening weak areas of the body. So modern Western massage owes a lot to his strong argument in continuation of Hippocrates' work of including massage in medical treatment. So for about 1,000 years, 500 BCE to 500 CE, Romans adopted Greek massage practices. In public baths, they also promoted massage as part of physical therapy, and even Julius Caesar was known to have received daily massages to relieve his neuralgia. So, from the Middle Ages to the Renaissance, so the 5th century to the 17th century, with the fall of Rome and the rise of the church, massage was often dismissed as pagan or sensual. So we have entered into the Dark Ages for the massage. Your licensing exam also often references the years between 450 and 1430, although it's arguably up until Ambrose Pare in the 1500s at the very least, and then his work becoming popularized in the 1600s is when massage finally was taken seriously again. So there was a solid 1,000 years where massage was considered sinful or pagan in the West. Ambrose Pare reintroduced massage for post-surgical recovery at that time, but don't fear. In Persia at that time, we have the canon of medicine being written, preserving medical knowledge during Europe's Dark Ages. And while Europe was mired in superstition and feudal chaos, now this is a direct quote from the Mosby's book, the Islamic countries became the intellectual center of the world. We have the canon of medicine that was created at this time. It's considered one of the most famous books in the history of medicine and remained a medical authority up until the 18th and early 19th centuries. So again, while the West was undergoing the Dark Ages, the East just kept plowing through. Again, we're still using energy channels, we're still focusing on the body, and we're still focusing on healing each other. While chaos is happening in the West, we still have order and massage in the East. So, not to wax poetic on it, but during the decline in Europe with the fall of Rome and the rise of the Christian church, Massage, of course, being dismissed as pagan or sensual. It is important to note that the common people tried to keep massage alive for its pain relieving benefits, but it ended up becoming part of folk culture. So, in this form, massage was important to healing traditions of the Slavs, our Slavic countries, the Finns and the Swedes, Finland and Sweden. Because massage was integrated into the health practices, though, of the common people, it was often associated with supernatural experiences and observances. This association alienated massage from what little scientific approach there had been during this time from Greece and Rome, and practitioners of folk medicine were often persecuted from the church, with the church claiming that the practitioners' healing powers came from the devil. This is a painting from 1587 called The Physician Considered the Devil, from allegories of the medical profession, with the populace coming in, and the physician here is represented as the devil, because the church in the West at the time did indeed believe that massage and associated medical practices were healing powers from the devil. All right, moving onward and forward, again mentioning Ambrose Paré because there is a light in the dark. He reintroduced massage for post-surgical recovery, and he was a champion of medical rubbing for rehabilitation. He used massage to treat joint stiffness and contractures, as well as post-amputation pain and neuroma pain, as well as just general pain relief. He had a very methodical, empirical approach. He didn't just use massage because it was traditional. Again, the folk medicine was really being looked down on. He observed its effects and developed a methodical approach. He classified different types of frictions in the way that Galen had, but a little bit more detailed, and applied them based on the patient's condition, advocating for gentle, moderate, or vigorous techniques in the ways that Galen had. The one thing that was truly different and important about Ambrose Paré is that he wrote extensively about his cases and techniques in his books. In his writing, he detailed about his manual therapies helping patients recover function and reduce pain where other methods had failed. And this is important when we talk about documenting your client's success in your SOAP notes or their lack thereof. Always document in case they need them, you need them, the court needs them, health insurance needs them. Document, and of course, you are legally required to keep those. One of the questions I often seen about Ambrose Paré on the licensing exam is calling him a French barber surgeon. Barber surgeons were part of a guild that performed a wide range of procedures, including bloodletting, tooth extraction, setting bones, and amputations. They were very different from university-trained physicians who actually at this time viewed surgery as a low-class manual labor position. All right, surgeons at this time were considered low-class manual laborers. So he really dug himself out of the trenches in rehabilitative medicine and is credited as a key figure in the reintroduction and systemization of medical massage in Europe after the Dark Ages. All right, moving onward and forward to 1776 to 1839, there is Per Henrik Ling. You may have heard, and your licensing exam might ask you about him and say that he is credited with developing Swedish massage, but he really was not. The term Swedish massage is inaccurate. The appropriate name is perhaps classical massage, and his program was Swedish gymnastic movements, also known as medical gymnastics and Swedish gymnastics. He did not teach massage as we know it. He had gout in his elbow, and many of these positions and movements of Swedish gymnastics helped to heal it. He became very interested in the newly discovered knowledge of circulation of the blood and lymph in the body, although it's very important to note that the Chinese had already been using these techniques for centuries. But in his system, and this is a quote from Mosby's, Ling divided movements into active, duplicated, and passive forms. Things that we call today range of motion work and stretching. He did teach many physicians from Germany, Austria, Russia, and England who spread his teachings to their own countries, and he was recognized not as a great innovator, but rather as a keen observer who adopted methods only after testing their effectiveness. He combined many techniques into one coherent system, and by the time of his death in 1839, his system had achieved worldwide recognition. So he should be known for the father of perhaps of refining Swedish gymnastic movements or medical gymnastics. But your test will very often ask about him and Swedish massage. Moving on to 1839 to 1909. Oh, how interesting. If you believe in reincarnation, maybe this is Ling coming back. Dr. Johann Metzger of Holland is credited with bringing massage to the scientific community. He presented massage to fellow physicians as a form of medical treatment. The French terms effleurage, petrissage, and tapotement were not used by Per Henrik Ling. They were chosen and put into the nomenclature by Metzger. He had a very successful experience in testimony of distinguished people, especially monarchs and diplomats, which bolstered the image of massage and increased public and medical acceptance. So here we are again, taking massage out of folk medicine and out of the hands of common people. And the more the monarchs and people of wealth and influence that use it, the more legitimate the practice seems. This Swedish movement of gymnastics and massage quickly spread to other European countries, and the first institute outside of Sweden was established in Denmark. In 1837, 2 years before Per Henrik Ling died, his disciple brought the movement here to Russia and established a clinic in St. Petersburg. Metzger was responsible for taking Ling's work and making it legitimate in the field of medicine. This was his most crucial achievement. In the 19th century, massage was often viewed with suspicion by the medical establishment, and Metzger changed this. He was a qualified physician. He had already earned his doctorate by 1868, and this gave him the credibility that Ling, who was a gymnast, did not have in medical circles. He used massage as a scientifically based therapeutic prescription for specific ailments like edema, joint stiffness, and muscle injuries, moving it away from being a vague health tonic. He published case studies and demonstrated successful outcomes, convincing his skeptical peers of massage's efficacy. Again, we have documentation for the win. Write down every success you have to show your progress along the way, to show that you know what you are talking about, especially if you are interested in forwarding any of your career work in your field of study. He was a brilliant clinician and marketer, and as Metzger's fame grew, he attracted an international clientele to his practice in Amsterdam. All right, moving onward and forward in the 19th century with Dr. Kellogg promoting massage and hydrotherapy in Michigan at his Battle Creek Sanatorium. He was also obsessed with constipation and bowel movements. Nurse-trained massage therapists worked in hospitals, especially during World War I, for rehabilitating soldiers. And in the United States, the first large waves of European immigration coming from Northern Europe had accepted massage earlier because of its therapeutic benefits. And the immigrants produced not only a lot of writers and teachers of massage, but also a lot of eager, trusting clientele that convinced others in America to join the movement. Two brothers, Charles and George Taylor, introduced the Swedish movement system created by Ling to the United States in 1856. They learned the skills from Dr. Roth, who was an English physician who studied directly with Per Henrik Ling, and Roth was also a leader in the homeopathic movement, and he believed that massage was quite a bit similar and believed that it would cure the body the same way. Going out a bit into the Pacific to Hawaii, we have Hawaiian Lomi Lomi, part of the Polynesian island practices of massage therapy. There is a temple style with sacred flowing strokes mimicking ocean waves that was often performed in rituals, as well as a strong focus on community healing. And massage was practiced in groups, blending prayer, breathwork, and long rhythmic strokes. In 1879, Douglas Graham described Lomi Lomi being practiced in the Hawaiian culture. He stated it was used as a hygienic measure to relieve fatigue or is performed simply for the pure pleasure of it. He continued to write on massage and its use in almost every area of medicine until his death in the late 1920s, but this is the first written instance we have in the West of Hawaiian Lomi Lomi massage. We have more instances of written letters coming in. Again, documentation, documentation, documentation. In 1889, a letter from a physician in Kansas appeared in a New York medical journal. The physician said that he had thought massage was just, quote, a novel method of therapeutics, end quote, until he had read a passage, again, documentation, from Captain James Cook's diary of his third voyage around the world near the end of the 1700s. Cook described how his pseudosciatic pain was relieved in an elegant and generous ritual by a Tahitian chief and his family. General massage, as the forerunner of wellness-based massage, emerged in the late 1800s as part of a treatment for nervous disorders, which consisted of complete rest, usually combined with systemic diet, massage, and other health practices, especially at a spa or sanatorium. So we have all these instances of Western physicians going out and exploring the world, seeing indigenous practices of massage for wellness and bringing it back and creating sanatoriums and spas and starting to take it seriously in the 1800s for medical massage. All right, North America in the 1900s. Let's fast forward real quick to the 1920s LA. Swedish massage meets movie stars. Suddenly, everyone wants a glow up and spa culture explodes. There's a decline in medical massage because, with the rise of pharmaceutical drugs and surgery, massage was seen as unscientific all of a sudden. Then there was the beauty industry boom, and massage became linked to spas and relaxation rather than medicine. So we were medically respected, then it was forgotten about, then it was seen as pagan for 1,000 years, then it was medical massage again, and now we're regulated to spas and relaxation because spa or massage is now unscientific again. Then we're going to the mid 1900s. New techniques are developed. We start to integrate physical therapy in with it, and it regains credibility in sports medicine and rehabilitation. Deep tissue massage becomes popular in the 1970s. Sports massage, like with Jack Meager in the 1980s. Myofascial release becomes popular in the 1980s, treating connective tissue restrictions. And then in the 2000s, we're really getting deep into clinical massage, prenatal massage, oncology massage, as well as things for pain relief, stress reduction, and recovery. So it is becoming better and better again as time goes on. It seems in the West, we're sort of on this cycle of scientific, unscientific with massage. All right, on our battle to make massage respectable again in the 1900s, we have a few key players. The first two are women. One is Dr. Elizabeth Dickey. She was a German physiotherapist, credited as creating connective tissue therapy or connective tissue massage. She was actually suffering from a life-threatening circulatory condition that threatened to lead to the amputation of her leg. While she was bedridden and in pain, she started to notice a hypersensitive pulling sensation in the connective tissue of her lower back and sacral region. And when she began to gently massage and stretch this tissue, She not only alleviated her local pain, but restored her circulation. This led to her creating connective tissue massage and learning about how to map specific zones on the body where connective tissue manipulation could affect specific organs and bodily systems. This almost sounds like body mapping for reflexology, as well as things such as connective tissue manipulation along energy lines. And again, I will refer to Eastern practices that have been put in place in the prior centuries. We also have Dr. Ida Rolf, who was a biochemist. She had her PhD from Columbia University. She was super interested in what made bodies become misaligned and how to restore their natural balance. She developed the Rolfing structural integration, often just called Rolfing. And her work is a deep holistic system of manipulating the body's fascia to restructure its alignment in gravity. Super interesting work. I recommend that you look into these separately as potential certifications. They do phenomenal benefit for your clients. Again, Dr. Elizabeth Dickey and Dr. Ida Rolf. All right, so now we're going to talk about manual lymphatic drainage. Your licensing exam is going to credit Dr. Emil Vader for creating manual lymphatic drainage. That is what is important to know for your test. Equally as important for you as a therapist to know, however, is Dr. Estrid Vader, his wife, as well as a professor couple, German-Hungarian couple, are also credited with this. So Emil and Estrid are the originators of what's called the Vader method, which is one of the things that you can get certified in for manual lymphatic drainage. They were both physiotherapists, and they noticed that many of their patients suffering from chronic colds and sinus infections had swollen and hardened lymph nodes in their necks. And contrary to the conventional medical advice at the time, which was to aggressively massage or even irradiate swollen glands, the Vaders hypothesized that a gentle, rhythmic, and pumping motion could stimulate the flow of lymph and improve the health of the nodes. So in 1932, they developed a specific set of hand movements characterized by light pressure, circular motions, and rhythmic pace, designed to manually encourage lymph flow. They called it manual lymphatic drainage, and they performed it at a health exhibition in Paris in 1936, which really excited the medical community. Now, the Foldies, Michael and his wife, Etelka, developed complex decongestive therapy, which is the modern version of manual lymphatic drainage that we use today, especially for treating things like lymphedema. So they used the Vader method, and they built on it a multimodal treatment program that uses manual lymphatic drainage as its central point, but not the only component. This is now basically the gold standard non-surgical treatment for lymphedema worldwide. So again, your licensing exam is going to credit Dr. Emil Vader for manual lymphatic drainage. Please recognize the other three individuals who were very instrumental in the development of this technique. All right, another notable lady for your test would be the pioneer of trigger point therapy, and that is Dr. Janet Travell. She was born in 1901, passed away in 1997. While the concept of painful muscular knots have been around for centuries, it was Dr. Travell who researched, defined, and developed the modern diagnosis and treatment of myofascial trigger points. All right. She provided a precise clinical definition as a, quote, hyper-irritable spot in a skeletal muscle that is associated with a hypersensitive, palpable nodule in a taut band. And again, she meticulously documented their characteristics and created textbooks and manuals. I will state here as well, she had a very important associate, Dr. David Simmons, who we never hear about, but Dr. David Simmons's work is nearly inseparable from hers, as they worked together to create the trigger point manuals. Um, Please be aware that there is similar phenomena that has been described in medical textbooks before, talking about muscular rheumatism, fibrositis, but it was Dr. Janet Travell who synthesized these observations into a teachable and clinically applicable system of diagnosis and treatment for trigger point therapy. So again, trigger point therapy is credited to Dr. Janet Travell. For your licensing exam. For your knowledge as a therapist, please also recognize Dr. David Simmons. All right, so we also have the Traeger method you may be asked about. The Traeger method was developed by Dr. Milton Traeger. And this is pretty interesting because he's not trained in medicine or bodywork. This is basically intuitive discovery. He wanted to be a boxer, but while he was training, he noticed he had a natural ability to affect his father's chronic back pain by using gentle rhythmic touch and movement. He began to finesse this. And since nobody really respected him because he lacked formal training, he wanted to gain legitimacy. So he enrolled in medical school in his 40s and he earned his medical doctorate to be able to spread this work. Again, document, document, document. And unfortunately, this is another case of if the technique is being used by the common folk and not recognized by the monarchs, the elites, the rich and famous, the doctors, it is not recognized as legitimate. So he gained his own legitimacy. The work is known as the Traeger approach or the Traeger psychophysical integration. He began the first trainings for this in 1975. And physicians and practitioners still carry on to this day, getting certified by the Traeger International Organization. So what is this? It's different than traditional physical therapy or massage. This is a mind-body approach that uses gentle, rhythmic, and non-intrusive movements to release deep-seated physical and mental patterns. The core idea is that many of our limitations are held in the unconscious mind as neurophysiological patterns. He also created what is trademarked as Mentastics. And this is a series of simple, playful, self-guided movements that clients are taught to practice at home. The word is a combination of mental and gymnastics, and it's supposed to reinforce the feelings of lightness and freedom experienced during the table work. So you have a practitioner doing table work with compression, rocking, and shaking of the client's body to reset the nervous system and introduce the body to new possibilities of freedom, lightness, and ease, combined with these mentastics that the client does at home. Again, this is the Traeger method, and it was developed by Dr. Milton Traeger. All right, we have two more notable names to cover. This one is super interesting to me and a technique that I am both certified in and absolutely love to utilize. This is cranial sacral therapy, which is attributed to Dr. John Upledger. Now, Dr. John Upledger built upon the work of Dr. Sutherland. Sutherland worked for Andrew Still, who was the founder of osteopathy. So Dr. Sutherland is an osteopath. And one day he was looking at a skull and he thought that the bones of the skull were designed for subtle movement, that they weren't just there to be solid and rigid and just protect your brain. And he proposed that the cerebral spinal fluid had a rhythmic tidal motion, which causes subtle movements in the cranial bones and the sacrum. Now, one day while Dr. Upledger was assisting in a neck surgery, he observed with his own eyes a rhythmic movement of the spinal dura mater that he could not explain. When he was told that it was likely this cranial rhythm that was described by Sutherland, he got deeply interested and started to deep dive into the subject. So from 1975 to 1983, He led a big team of anatomists, physiologists, biophysicists, bioengineers at Michigan State University to test the principles of the cranial system. And he created a scientific framework for more than just osteopaths to use. So practitioners such as massage therapists, physical therapists, and chiropractors have access to this work now with this subtle movement of the cerebral spinal fluid affecting the bones of the sacrum and the cranium through Dr. John Upledger. Again, this is cranial sacral therapy, Dr. John Upledger. I will mention one of the theories of babies sucking their thumb that was taught to me that I always found very interesting is very often it is being done when they are no longer nursing because the vomer at the roof of the mouth is stuck. And this is an example of very light work to be able to actually pull down and drop a bone in the cranium with very light movements. This work is phenomenal. And for any of my students interested in looking in a gentle work that they can perform that has very strong responses in some clients, this would be an excellent one for you to study and become certified in. All right, our last notable mention of the day for Western massage is going to be the father of chair massage, who is David Palmer. I remember him as you usually use your palms working on someone in chair massage, David Palmer. While massage in a seated position has indeed existed for centuries, especially in Japan with anma and in barber chairs, David Palmer transformed it into a distinct, portable, and accessible service for the general public and corporate world in the 1980s. Capitalism, baby. He created the seated acupressure massage model. He built a standardized, time-efficient protocol for giving a massage to a fully clothed person seated in a specially designed chair. He focused on the upper body, back, neck, shoulders, arms, and head, where people hold most of their stress. This is perfect for corporate massage. In fact, he introduced massage to the workplace, and his most significant achievement was his marketing genius. He successfully introduced chair massage as an on-site corporate wellness service. His most famous early client was Apple Computers in 1986. Again, you find that big client that will endorse you and your work goes viral in the way that it could in the 1980s. So this demonstrated the powerful benefits of massage for reducing workplace stress, improving morale, and reducing repetitive strain injuries. I will also mention Jack Meager here. He was a sports massage pioneer who used seated positions as well in the 1970s before Palmer's commercial efforts. His work demonstrated the practical application of seated massage in a non-clinical setting, making it popular in the fitness realm. But of course, Palmer is best known for making it incredibly popular and commercialized. And now we have easy access and affordable massage chairs because of it. All right, guys, that is it for today. I know that was quite a lot to take in. Very important knowledge for your licensing exams. Please let me know if you have any questions, and I will see you on the next one.